good morning. I am Mr. Javerick B. Amis. I am from Iligan Medical Center College. For now, I'll be preparing and administering for the medications, which is the oral and parenteral medications for the patient. So now, first, I'm going to introduce to you on what to prepare for administering parenteral medications. So I have here the tuberculin syringe. Tuberculin syringe. The syringe 3 ml. I have here the 3 ml. And then the needle gauge, which is number 23. Here. The alcohol soaked cotton balls or alcohol swabs. I have here the alcohol soaked cotton balls or alcohol swabs, but I prefer to use alcohol soaked cotton balls because it's easy. And then the dry cotton balls I have here. The medicine in an ampule. Here, I have here the medicine in ampule. The medicine in vial. In a vial I have here, which is the sterile water for injection. And also a tray with towel lining here. A tray with towel lining. And also I have here the doctor's medication sheet and doctor's order sheet, and also the medication sheet, and also I have here the medicine tickets. I have here the medicine tickets, and I have here the waste receptacles. So next is we're going to proceed to the parenteral administering medication. So in parenteral administering medication is first is you need to check the accuracy and completeness of each medicine ticket with doctor's order sheet. Check patient's name, medication, and dosage, route, and time of administration. So again, you need to check from the doctor's order sheet. To ensure that the right patient receives the right drug. And the next is you need to review pertinent information related to medication, which are the action, the purpose, normal dose and route, and also the side effects, and time and onset, and peak action and nursing implications. So you need to inspect also or review the action of your patient, the purpose of this medicine, and then the normal dose and route for the medications to your patient, to allows you to anticipate effects of drug and observe the patient's response. So next is to assess patient's body build, muscle size, and weight if giving subcutaneous or intramuscular injection. So the reason is why we need to assess the patient's body build, the size, the muscle size of the patient, the weight for the subcutaneous or intramuscular injection is to determine what size of syringe is needed for the medication, for the said medication. So after those assessing, you need to perform the hand hygiene first before proceeding to the procedure, to avoid or to reduce transmission of microorganisms. So next is prepare medication. Check the medication twice, check expiration date, so to avoid any medication error and provide safety. So the expiration date of this ampule will still be on 2022 at June. Okay, so it's still okay. The sterile water for injection 2023 is the expiration. Still good. Next is to remove cup, covering top of unusual vial to express sterile rubber seal. So keeping rubber seal, so you have here the sterile water with the rubber seal. If a multi-dose vial has been used before, so cap is removed, so firmly and briskly wipe the surface of the rubber seal with alcohol swab and allow it to dry. So the reason is we need to ensure that the surface of rubber seal is still sterilized. So pick up the, okay, I have here, so I'm going to, yeah, okay, I'm just twisting it to open. So it's already open. So this part of the still water cup is you need to put it in the waste receptacle. So after opening the cup or removing the cup covering of the vial, you need to pick up syringe and remove needle cap or cap covering the vial. So pull back on plunger. So this is you need to put it into what do we call this one? Syringe. So the sterile water for injection is 1 ml. So I have here in the medicine ticket, just to remind us that it is correct. So the waste is put in the waste receptacles. So before you're going to get some of the sterile water for injection, is you need to remove first the needle and change the needle into gauge 23. It's because the gauge 23 needle is more longer than those needle for the tuberculin syringe. Okay. So I have here. So when injecting, just hold the syringe by forming at the dart position, so just like this. So straight. Wait. Okay. Okay. So it's already intact. So eye level. Five ml. So you have it ready. So you just need to ensure that there is no air or bubbles inside. Okay, so it's already good. So now change the needle to the needle that you're going to use for injecting. So you put it in the waste receptacles. So now going back the normal syringe for the, okay, that's right. So the remaining is you need to keep it into the basket. Okay. So next is the ranitidine the ranitidine roxide, which is 50 milligram or 0.5. So pick up the syringe and remove needle cap or cap covering the vial to pull back on the plunger to return amount of air into syringe is equal to volume of medication to be aspirated from vial. So the reason of this one is to prevent buildup of negative pressure in vial. So when aspirating medications are already done performing it. So next is with the vial on flat surface, insert tip of needle with beveled tip entering first. So already done. So I'm already done performing it. So to prevent tearing the rubber seal that could contaminate the vial, so inject air into air space of vial holding on the plunger. So here, just only here. And hold plunger with firm pressure, air pressure within vial sometimes, so forces plunger backwards because of the air that's not being inserted. And then to get the reason is to get medication flow into the syringe and to prevent formation of bubble that may lead to inaccuracy of dose. So you need also to check the syringe if there's any bubble been seeing represent. And next is to invert a vial while keeping firm hold on syringe and plunger. So hold vial between the thumb and the middle. So here, just like here. Hold of non-dominant hand to avoid contamination. So do not touch this part of this syringe. And grasp end of syringe barrel and plunger with thumb and forefinger of dominant hand to counteract pressure on vial to allow fluid to settle in lower part of the vial and to prevent any forceful movement. So next is to keep tip of needle below fluid level. So just like this, fluid level. So to prevent aspiration of air. So allow air pressure from vial to fill gradually with medication. So if necessary, pull back. So if necessary to pull it back, this. So you need to do it. So slightly the plunger. So just simply slightly pull it down to contain correct amount of solution. So as I did earlier that I am doing just like pull it down to force liquid into the syringe. So next is when desired volume is obtained, position needle into air space a vial, tap the side of the syringe barrel carefully or dislodge any air bubble. So if you see any air bubble inside the syringe, you just need to let it out. Okay, so good now. And to prevent any medication error and to avoid bending the needle. So next is remove the needle vial by pulling back a barrel of syringe. So done. Okay. So to prevent accidentally pulling the plunge and separating it from the barrel. So hold syringe at eye level, just like this, at 90-degree angle to ensure correct volume and absence of air bubbles. To remove any remaining air by tapping barrel to dislodge air bubble, just like this by doing like this one. Draw back slightly on plunger, push plunger upward to eject, just like this. So if you're going to do this one, so push the plunger upward. To recheck volume of medication. The reason of this is to allow fluid to settle at the bottom of the barrel and allow the fluid within the needle to enter the barrel so it's not expelled to expel air at the top of the barrel and within the needle. So next is if medication will be injected into patient's tissue, change the needle to appropriate gauge and length according to the said. And then start inserting needles through the rubber stopper dulls the tip of the needle. So I'm already changing it from gauge 23, which is I'm using before. So I'm already changing it into to normal syringe, normal gauge of the tuberculin syringe. So next is the for multi-dose vial, make label that includes date of mixing, concentration of medication per milliliter, and your initials. To ensure future dose is properly prepared. So next is to prepare in parenteral administration. Next is preparing the ampule. So tap the top of ampule lightly and quickly with finger until fluid moves from neck of ampule. So I have here the ampule already. Here's the ampule, guys. To move all fluid into the lower part of the ampule. So place small gauze pad or an opened alcohol swab just above neck of ampule. So here. To avoid getting injured. I have here the alcohol swabs. So put in the waste receptacles. So snap neck of ampule quickly and firmly away from the hands to protect fingers and face. So if you are going to break this, it's like this to avoid injury. So draw up medication quickly using a needle long enough to reach bottom of ampule. So in breaking this, just make sure that you are avoiding some injuries after doing this one. Oh my god, it's perfect. So put it in the what they call this one, the waste receptacles. So to avoid contaminating the ampule. So hold ampule upside down here or set in the flat surface with needle. So I have here the needle. So do not center of the ampule openings. Do not allow needle tip or shaft to touch rim of ampule. So do not let the needle of your syringe touch the rim of the ampule, which is the broken rim, to avoid contaminating of the ampule. So here, so aspirate medication into syringe by gently pulling back on plungers. So I'll put some air. So if this is 0.5, yes, 0.5. So put some air, 0.52. Okay, I have here. So now I'm going to aspirate it now. Okay, over here. Ready? Next is to keep needle tip under surface of the liquid. So tip ampule to bring all fluid with reach of needle. So I have here the 0.5. Oops. Okay, good. So to prevent, if air bubbles are aspirated, do not expel air into ampule. So you need to do like this, and click just like this, to prevent the fluid from getting out of the ampule. So next is to expel excess air bubbles. Remove the needle for ampule. So hold syringe with needle pointing up, just like this, pointing up. Top side of syringe to cause bubbles to rise toward needle. So draw back slightly on plunger and push plunger upward to eject air. Do not eject fluid. Okay? So remember, do not eject the fluid, just only the air or the bubbles. So just like this. Okay, there's no air already. To allow fluid to settle at the bottom of the barrel so it is not expelled. So next is, if syringe contains excess fluid, use sink, hold syringe vertically with needle tip of and slanted slightly toward sink. So slowly eject excess fluid into sink. Recheck fluid level in syringe by holding it vertically. So if you think that your medication or the medicine that you are putting in the syringe is too much, so if you're going to reduce it, put it in the sink. So by doing the vertical level, just like this. Okay. So I have already the 0.5 milliliter. So to ensure medication expelled correctly. So next is to scoop needle to recap to prevent injury. So this returning the cap. So compare label of medication with medicine ticket for final time at patient's bedside before administering medication. So you need to finalize if the medication that you've been going to give to your patient is correct, to avoid medication error. So you need to repeat it or read it twice to ensure that the patient receives the right drug. And also return the unused multi-dose medication vial to shelf. So here, the vial and the ampule, so returning it in back. For proper storage.